Welcome back to West New York Living. We're taking some time this morning over our first half hour to team up with Windsong Radiology to discuss a very important topic for all women, especially for those over the age of 40. It's yearly mammograms and the programs they provide at Windsong to help women better understand their breast care risks. Some of the simple tests and imaging they are providing can help detect breast cancer at its earliest stages. It should come as no surprise to anyone that early detection is the key to fighting any type of cancer. That is why yearly screenings are so important.
I will say that Windsong strongly recommends annual mammograms once you turn 40 if you are an average risk population. And the reason why the yearly exam is so important is that things can change from year to year. And I know we talked about the genetic predisposition of women who may need to be screened sooner than age 40, but I will let you know that most of the women that we diagnose with breast cancer actually don't have any family history. Only about 10 to 15% of the population has a genetic component, and that's why it's so important for the rest of the population to still be screened yearly.
One of the key factors that can affect any breast image is dense breast tissue. It makes it harder to pick up breast cancer on a mammogram. Since 2011, Windsong has been offering 3D mammography to better assist with early detection of breast cancer.
Women have two types of breast tissue. One is dense breast tissue and one is fatty tissue, and pretty much everyone has their own combination of both. But when you have more of the dense breast tissue, it can hide certain ways that cancers can prevent mammographically, and so that's why it's important to know if you have dense breast tissue. Does every woman with dense breast tissue need additional supplemental screening? Not always, but it's important to know, and that's where we can tie in the fact of dense breast tissue and any family history to see if additional screening is needed.
Windsong Radiology also offers two other very unique tools that can help women better assess their risk for breast cancer. With genetic testing and their newly designed personalized risk assessment, they can eliminate uncertainty and assure high-risk women they are receiving the information that need to protect their health.
Genetic testing can be really important because someone may not know that they're at higher risk than the general population. If they go through a risk assessment, we can determine if they are actually at higher risk than someone who is average risk, and what that would mean for us is that they may need additional surveillance earlier, or they may need additional surveillance with additional imaging on top of mammographic studies.
So the risk assessment is part of our legacy, starting with Janet Zhang, where we initially and always have committed to do a personalized approach to screening, which now is even more important than it was 20, 30 years ago, because now we have the tools, we have the laws in New York that we can add ultrasound, screening ultrasound, that we can add MRI. And for that purpose, we need to know as much as we can about the individualized situation of that particular patient. And that includes the density of your mammogram, and also if you might be a carrier for one of these genes, what's your lifetime risk? All that factors in. When we do that risk stratification, approximately 10 to 15% of the participants will be flagged as you're going to benefit to get some genetic counseling testing. And of all these, most will end up getting a test, a genetic test. And of these, only a very small fraction will end up having these genetic markers, which create that pretty high lifetime risk. So the risk assessment is basically, as we roll it out on an iPad, a bunch of questions. Usually it lasts between 3 and maybe 10 minutes, depending on how many family members are involved. And when the patient's leaving, we can give them the results. So if there's a lifetime risk of, let's say, more than 20%, in general, insurance companies in the US would pay for an MRI as an additional screening. MRI shows, in average, as far as we know, 4 times as many cancers as mammograms. So a certain population benefits from that greatly.
A personalized risk assessment at Windsong Radiology is just another tool they have set up to benefit both their patients and doctors. It's a brief questionnaire that patients will find out when they have their annual breast cancer screenings. You can find out more about all the breast care services Windsong provides on their website at windsongwny.com.